Imagine this for a moment. You're at home. Maybe the television is playing in the background. Maybe you're sitting quietly with a book or scrolling on your phone. And then something feels wrong. Your chest begins to feel tight. Not sharp pain yet, and more like a heavy pressure. Your breathing changes, your left arm starts to feel strange, maybe tingling, maybe weak. And suddenly you realize this might be a heart attack, and you are completely alone. This exact situation happens to hundreds of thousands of older adults every single year. In the United States alone, more than 380,000 people experience heart attacks while no one else is with them. No family, no neighbors, no immediate help. But here's the part most people never hear. A large study published in the European Heart Journal found that people who knew what to do within the first 60 seconds of symptoms increased their chance of survival by more than 70%, not because of medicine, not because of luck, but because they acted correctly, immediately. And yet, nearly 9 out of 10 adults over 60 have never been taught what to do if a heart attack starts while they're alone. They panic, they freeze, or they make choices that actually reduce their chances of surviving. Today, I'm going to walk you through 7 medically supported actions that can help keep you alive long enough for emergency help to arrive. These are not home remedies. They are not social media tricks. They are steps supported by cardiologists, emergency physicians, and real emergency survival data. And stay with me until the end, because tip number 1 provides a survival advantage that comes surprisingly close to having a medical professional already in your home. Before we continue, I'd love to know, how old are you and where are you watching from? We read your comments, and your answers help guide future videos for people just like you. Now let's begin. Tip number 7, build your emergency communication system before you need it. This one sounds simple, but during a heart attack, even simple things become very difficult. Within the first 30 seconds of reduced oxygen to the brain, many people experience confusion, shaky coordination, trouble thinking clearly, difficulty speaking, short-term memory problems. In one study of heart attack survivors over age 60, more than half could not remember their own home address when calling for help. That means preparation must happen before an emergency, not during one. Here's what you should do today, not tomorrow. First, write your full home address on a bright piece of paper. Include apartment number, building entrance, gate codes, anything emergency teams might need. Tape it next to every phone in your home. Second, program emergency services into speed dial on every phone. Yes, even though you know the number. When your hands are shaking and your thinking is slow, one button can save your life. Third, keep your phone charged and within arm's reach, especially at night. Many serious cardiac events happen during sleep, when phones are charging in another room. Fourth, if you live alone, use a medical alert device and wear it all the time, even in the shower. Many people own them, but aren't wearing them when they collapse. Fifth, tell at least one neighbor, building staff member, or nearby friend that you have heart risk factors. If possible, give someone a spare key. Yes, privacy matters. But in a cardiac emergency, minutes matter more than privacy. This system by itself does not stop a heart attack. But what it does is remove delays. And delays are what turn survivable heart attacks into fatal ones. Now let's talk about a technique that can help keep you conscious while help is on the way. Tip number 6, cough CPR, when it helps and when it does not. You may have heard about something called cough CPR. Some people talk about it like it's a miracle trick that can stop a heart attack. That is not true. But when used at the right moment for the right reason, it can help you stay conscious a little longer while emergency help is on the way. Here's what's really happening. During some heart attacks, the heart's rhythm becomes unstable. When that happens, blood pressure can suddenly drop. Coughing forcefully increases pressure inside your chest, which can briefly help push blood toward your brain. In monitored hospital settings, patients who were taught this technique were sometimes able to remain conscious longer during dangerous rhythm disturbances until medical teams intervened. But this only works in very specific situations and only for short periods. So here is the correct way to do it, and this part matters. At the very first signs of trouble, while you are still awake and able to breathe normally, take a deep breath, filling your lungs fully, then cough hard and deep from your chest. Repeat every 2 seconds. Deep breath. Strong cough. Repeat. The cough must come from deep in your chest, not your throat. Each deep breath brings in oxygen. Each strong cough helps move blood forward for a moment. But this is critical to understand. Cough CPR does not stop a heart attack. It does not replace calling emergency services. And it should never delay calling for help. It is only meant to help you stay conscious while help is already on the way. And once severe chest pain, dizziness, or fainting begins, this technique is no longer helpful. That's why learning this before an emergency matters. You will not be in the condition to search for instructions when your heart is already struggling. Now let's talk about a medication almost everyone has heard about, but most people use incorrectly in emergencies. Tip G5, the aspirin mistake that costs lives. You've probably heard someone say, take an aspirin during a heart attack. That advice is correct, but incomplete. Because how you take aspirin can determine how fast it works, and during a heart attack, speed is everything. Most heart attacks happen because a blood clot blocks one of the arteries that feed the heart. Aspirin does not dissolve the clot, but it prevents the clot from getting larger, giving blood a chance to squeeze past and reach heart muscle. Large studies show that taking aspirin early can significantly reduce death risk. But here is what most people don't know. You must chew the aspirin. When you chew it, aspirin is absorbed directly through tissues in your mouth and stomach lining, entering your bloodstream much faster. If you swallow it whole, it can take much longer to start working, time your heart muscle may not have. Correct emergency dose. Total of 325 mg. Either 1 regular strength aspirin or 4 baby aspirins. Chew it completely, even though it tastes bitter. Do not wait for symptoms to see what happens. If you suspect a heart attack, chew the aspirin immediately after calling emergency services. Very important safety notes. If you are allergic to aspirin, do not take it. If you are already on prescription blood thinners, your doctor should have given you specific instructions. Do not use coated or enteric aspirin for emergencies. They absorb too slowly. And here's another mistake many people make. They keep aspirin only in the kitchen or bathroom. During an emergency, you may not be able to walk across your home. Keep aspirin in multiple locations. Bedroom, living room, kitchen, purse, or wallet. If you leave home often, check expiration dates twice a year. Old aspirin may not work properly. Aspirin does not stop a heart attack, but when used correctly, it can slow the damage until medical treatment arrives. Now let's move to something that affects your heart immediately, your body position. Tip number 4, the safest body position. During a cardiac emergency, when chest discomfort starts, many people instinctively lie flat on the bed or begin walking around the room. Both of these reactions can place extra strain on the heart. Your body position directly affects how easily your heart can pump, how well your lungs can expand, how much oxygen reaches your brain. For most people, the safest position is called the semi-reclined position. Here's what that looks like. Sit upright at about a 45-degree angle. Support your back with pillows, a couch, or a wall. Keep your knees slightly bent and your feet flat on the floor. This position helps in several ways. It reduces pressure on the heart, it makes breathing easier, and it helps prevent fluid from shifting into the lungs, which can increase breathing discomfort. If you begin to feel faint, lightheaded, or unsteady, lower yourself carefully to the floor. Do not drop suddenly. Once on the floor, turn onto your side, rather than lying flat on your back. This helps keep your airway open if you feel weak or drowsy, and it also makes it easier for emergency responders to assist you if needed. Loosen anything that may restrict breathing. Belts, tight waistbands, collars, neckwear bras, or tight clothing. Even mild pressure around the chest or abdomen can make breathing harder when your heart is already working harder than usual. Also, try to keep the room comfortably cool, not cold. Overheating increases the heart's workload and can worsen discomfort. This position does not stop what is happening in your heart, but it can reduce strain and help your body cope while help is on the way. Now let's talk about something that directly affects how much oxygen your heart and brain receive. Tip number 3, controlled breathing that helps protect the heart. When people feel chest pressure or shortness of breath, panic often takes over. Breathing becomes fast and shallow. This feels natural, but it is not helpful. Rapid, shallow breathing can reduce how much oxygen actually reaches the bloodstream. Increase strain on the heart, worsen feelings of tightness and fear. Studies show that people who are able to slow and control their breathing during cardiac stress often experience less strain on the heart muscle. The goal is not to take huge breaths. The goal is to breathe slowly and deeply using the diaphragm. Here is the method to remember. It's called paced diaphragmatic breathing. How to do it. Breathe in through your nose for 4 seconds. Hold gently for 4 seconds. Exhale slowly through pursed lips for 6 seconds. That long, slow exhale is especially important. It activates the calming branch of your nervous system and reduces oxygen demand on the heart. To help make sure you are doing it correctly, place one hand on your chest and one on your belly. Your belly should rise more than your chest. If you can, count the seconds out loud. This does two helpful things. It keeps your breathing rhythm steady, and it lets emergency dispatchers know you are still conscious if you are on the phone with them. This type of breathing can slow the heart rate lower, blood pressure slightly improve oxygen delivery, reduce panic-driven strain on the body. And here is something very important. This technique works best if you practice it before you ever need it. Trying to learn it for the first time during an emergency is much harder. Even practicing once or twice a week when you are calm can make it much easier to use when stress is high. Now we move to a step that almost no one thinks about, but it can save precious minutes when every second counts. Tip number 2, the emergency door and access. Step most people forget. This next step may sound simple, but it solves one of the biggest problems emergency teams face when someone is alone at home. They arrive, but they can't reach the person fast enough. Studies reviewing thousands of emergency calls show that delayed access to the home is one of the most common reasons care is slowed during serious cardiac events. So here is the rule to remember. At the very first sign of serious symptoms, unlock your door first. Do this before sitting down, before calling anyone, before symptoms intensify. While you still have coordination and strength, unlock your front door, leave it slightly open if possible. This single action can save several minutes, and those minutes matter. If you live in an apartment or building, call emergency services, then immediately call the front desk or building security if available. This helps responders reach you faster once they arrive. Additional smart precautions you can prepare ahead of time. Keep a visible emergency information sheet near the door, include medications, allergies, and health conditions. Turn on lights in your home so responders can see clearly if possible. Use a lockbox or smart lock registered with local emergency services. That allows responders to enter without delay, even if you cannot reach the door. These steps don't treat the heart directly, but they remove barriers, and removing barriers saves time. And now we come to the final step, the one that can provide the strongest immediate support for certain people. Type number 1, nitroglycerin. When it helps and how to use it safely. This final tip applies only to people who have already been prescribed nitroglycerin by their healthcare provider. If you do not have a prescription, this step does not apply to you. Nitroglycerin works by relaxing blood vessels, reducing strain on the heart, improving blood flow through narrowed arteries. When used early and correctly, studies show it can significantly reduce strain on the heart while waiting for medical care. Here is the correct way to use it. At the first signs of concerning symptoms, sit down immediately. Never take nitroglycerin while standing. Place 1 tablet under your tongue. Do not swallow it, let it dissolve completely. This usually takes about 20 to 30 seconds. A mild warmth, tingling, or slight headache can be normal and expected. Set a 5-minute timer. If symptoms do not improve, take a second tablet after 5 minutes, wait another 5 minutes if still needed, take a third tablet. Never take more than 3 tablets within 15 minutes. Important safety reminders. Never combine nitroglycerin with medications for erectile function. Always store it in its original glass bottle. Replace it every 6 months. Keep it in more than one place in your home. If a tablet produces no sensation at all, it may no longer be effective and should be replaced. Many people carry nitroglycerin but hesitate to use it or are unsure how to take it properly. Knowing the correct steps before an emergency makes a real difference. These 7 actions are not meant to replace professional care. They are meant to support your body during the critical minutes while help is on the way. Preparation matters. Practice calm breathing. Check your supplies. Make emergency access easy. Being informed does not create fear, it creates confidence, and confidence helps you act when it matters most. If you found this video helpful, consider sharing it with someone who lives alone or helps care for an older loved one. And I'd like to ask you, have you ever faced a medical emergency alone or helped someone who did? If you feel comfortable sharing, your experience may help someone else feel more prepared. Thank you for spending this time with me today. Take good care of yourself, and I'll see you in the next video.